First District Health Unit, Randy Schwan with Trinity Health, Dr. Mark Vollmer, the Superintendent of Minot Public Schools, Sean Sitma, Mayor of City of Minot, and myself on behalf of Ward County. First up, we have you, Lisa.
Good afternoon. This week, we have conducted 486 tests throughout the district. So total tests to date in Bottineau County, they have had 253 tests. They have one positive case. Burke County has had 125 tests, and they have 5 cases. McHenry has had 274 cases conducted, and they have 2 COVID cases. McLean has had 565 tests conducted to date with 7 positive cases. Renville has had 140 tests conducted, and they have 1 positive case. Sheraton has had 37 tests conducted, and they have no positive cases. Ward County has had 3,308 tests conducted with 28 positive cases. We have had 3 new cases this past week in the district. Bottineau has 1 positive case that is currently under investigation. McLean has had 2 additional cases identified, 1 community transmission, and 1 is under investigation. Yesterday and today, we've been very busy in this community. We have conducted 775 tests. We have prioritized and conducted those tests to medical providers, healthcare providers that have direct patient contact within the Minot community. We have tested the Minot Police Department, the Ward County Sheriff's Department, and jail staff. Also, the community ambulance has been tested. So by about right now, there are 775 tests at the state lab. We should have results within the typical time period. I talked to the state lab earlier today. They are pretty much so on schedule, so we should see those results in about 3 days. Sometimes a little bit more, sometimes a little less. So most of those, the healthcare providers throughout the area did their own tests, so we dispersed those tests out to the healthcare providers, and they tested their own staff. Those tests then were either referred back to or brought back to First District, and we transported to the lab, or Trinity has a courier service that their tests were sent down to the state lab also. So we will, in fact, we are planning events throughout the district. Nothing is confirmed right now, but I would suspect our next events will be in Bottineau and also in the Burke-Renville area. And I would expect those to happen next week, but those are all tentative until we get test kit confirmation. So stay tuned for that. If you have any questions on Smart Restart guidelines, check out our websites or North Dakota Department of Health. If you have additional questions or would like somebody to visit with about that, feel free to contact our office at 852-1376, and we would have staff available to help you with that. So stay well and stay tuned. Thank you.
Thank you, Lisa. Up next, we have Randy Schwan with Trinity Health.
Thank you. Well, good afternoon. I have a few notes, then I'll stand for questions. But first, I wanted to say happy EMS week, right? Emergency Medical System Week. It's a time when we celebrate those folks who are in our community and across the region, across the nation. They work shoulder to shoulder with their colleagues in public safety, police, and fire. But EMS primary mission is emergency medical care. It involves ambulances, pre-hospital, hospital, and post. So they're on the front lines of this pandemic. They're on the front lines every day, even outside this pandemic. We take a moment to thank them for the work that they do. I would like to shout out to the Minot Air Force Base, and they performed a flyover over medical facilities across North Dakota yesterday, including Trinity Health, as they honored those in healthcare. If anyone qualifies as essential workers, it'd be the men and women of our armed services. And for them to take time out of their busy schedule to honor healthcare across the state, was pretty cool, and everybody really enjoyed that display. Finally, we are conducting sentinel testing at Trinity Health, as Lisa described. Nearly 500 tests were conducted over the last 2 days in our clinics and in our hospital. Part of Governor Burgum's expanded initiative to include more proactive testing for health care across the state, health care, long-term care, other congregate living. So we participated in that willingly and welcome that opportunity. We look forward to more of that in this community and across the healthcare community in North Dakota to help prevent community spread, keep our staff and patients safe as possible. I might add that the effort went very smoothly, around 500 tests in a day and a half, and it's not a small undertaking. Just appreciate the work that went into that and the staff's cooperation with that, and look forward to those results that we can take action on. That's all I have. Thank you.
Thank you, Randy. Up next, we have Dr. Vollmer.
Thank you, Jennifer, and thanks everyone for being here today. Let's start with graduation. Graduation is going to be Friday night at the North Dakota State Fairgrounds Grandstand. It is the only venue that is large enough to allow us to have nearly 450 graduates and each allowed to bring 2 guests. We had about 250 extra tickets, which we used a lottery system to get in the hands of as many people as we could to be there while social distancing. So big shout out to Renee at the State Fairgrounds. Superintendent Korsling and her crew have done a phenomenal job in making this happen for our seniors. We have had many kindergarten graduations this week and 8th grade graduations and 5th grade celebrations for those students going into middle school, and we've used a social distancing model on each. There are far too many to go over with everybody, but I do want to thank our staff for their creativity in finding ways to honor those kids in a very unusual type of situation, and right now in a very unusual world. So graduation Friday night at the Minot, or at the fairgrounds. Unless you're a parent of a graduate, don't bother coming, okay? We're going to be very limited. But we are going to be broadcasting that. It'll be on our Facebook Live feed. It will be on our school website and also the Magic City Campus website. So plenty of opportunities to do that, and we'll also be putting together a video for all of the seniors that will involve all of the awards programs that were pre-recorded and everything else. So hats off to that crew that worked to make that happen for our kids. The rest of what I wanted to talk about, we have a lot of questions coming on what extended school year and summer school programs and CLC might look like. I'm going to be very quick, hopefully, in doing this for you today. First of all, special education extended school year is for our special needs population. Those are dictated by decisions that our teams are making, our IEP teams. We're going to be running our program a little differently this year, using basically a blended model where kids will be in session part of the time, half of the kids one day, followed by half of the kids the next day, and there'll be different activities they can do on the alternate days when they're not in person. For families that have very specific health needs, we will be offering for our special education students the opportunity to do a virtual program, which they could do everything from home. That is an offering for this summer only. It is not something that the district plans or is committed to in the future, but we do know that this is something that we need to get rolling and make happen for our students. That is going to start on June 7th. And it will end on July 22nd, with the week of June 28th through July 4th being off for a break, as a midterm break, I guess you could say. All of our students are going to be scanned. If they are using school district transportation to and from school, they will be scanned for temperature and for symptoms before they get on the bus in the morning. All others that are dropped off by parents will go through a similar process in the school. Masks are required anytime social distancing is not possible, and we will follow Superintendent Basler's North Dakota Smart Restart guidelines, and we will, if need be, if we're seeing cases of COVID-19 in our schools, or if we see cases in our community, then we will transfer to a distance learning model. For the remainder of our programs, there are a couple of general guidelines I just want to cover. All students will be scanned for temperature and symptoms before entering our buildings. Masks will be required for staff and students again when that social distancing is not possible. We will be taking daily attendance. A diagnosis of COVID-19 will result into that transition to a distance learning model, very similar to what we're doing to finish out this semester. There will be limited access to multi-use bathrooms, with emphasis on staggering bathroom breaks and extensive cleaning in bathrooms and common areas, and limited access to larger areas such as gymnasiums, lunchrooms, and playgrounds. And when they are accessed, there will be extensive cleaning in all of those areas. Our English language learners are going to be having their summer school program beginning on June 8th and completing on June 26th. That is going to be a blended model, again, half of the time in person with the teacher, following all social distancing guidelines, and half of the time will be on online activities, with Friday online sessions that are going to be for remediation and special intervention to help students who are struggling. Our elementary program, we are actually going to wait this year until July 13th and run that through July 31st. At this stage of the game, we're planning an in-person program for our elementary kids. And if we're going to reevaluate that on July 6th, and again, that is going to come right down to North Dakota Department of Health guidelines and where we are at with our community. We are going to be placing an emphasis on technology integration and district-supported community communication platforms during that summer learning program. Things like IXL and using PowerSchool as a communication for parents, where we need to be a little more positive and better productive users. Also, implementation of Google Classroom, which we've used pretty successfully in our secondary schools. Middle school, and there will be starting at Jim Hill on June 8th. Magic City will be running the high school program also on June 8th. Those programs will go until June 26th as well, and it'll be a blended model again. If we're going to follow safe social distancing guidelines, 6 feet protection or space around every individual, our classrooms are not large enough to have 20 students in. So we have to pare that number down, and we can do that pretty comfortably with 10 or 12 students at a time. That is the purpose for that blended model. Again, alternating days, we have 2 tracks, track A on Mondays and Wednesdays, track B on Tuesdays and Thursdays, followed by Friday being a time where we can use technology to provide interventions for students and remediation for anyone who is needing a little help. Our CLC program. We are going ahead with our CLC program. We're going to begin that on June 1st with what we call a soft rollout. We're going to be taking no more than 125 at each site. with a potential expansion, and that would not happen sooner than June 15th, 2020. But that potential expansion will be, again, simply based on infection rate data that is coming to us from Lisa and the crew at First District Health and the North Dakota Department of Health. If it's safe to continue, we'll continue. We might allow a few more students in, but again, those are all going to be decisions that are going to be dictated through the data that is coming through us. And what you will hear from me and the school district from this point on is that these types of decisions have to be data related. We have to be looking at infection rates in our community. We have to be looking at what we can do to keep people safe. And we have to make sure that we are doing everything within our power to make sure that we are following those North Dakota Smart Restart guidelines. That includes all of the social distancing and all of those other issues. The last area I want to talk to you about today is lunch. As you know, we've been serving lunch and breakfast like many other schools in the state. We are serving right now about 3,200 lunches a day, and every student that picks up a lunch is getting a breakfast for the next morning. So we're right around that, 6,400, 6,500 meals going out a day between Minot and Minot Air Force Base. We are going to scale back slightly on that, on the locations that we will be running out of, but we are going to continue that service now until the 30th of June. So meals will continue at Magic City Campus, Longfellow, Washington, Roosevelt, and Dakota, or Memorial at the Dakota, or Minot Air Force Base. And this will continue on after a period of time, after the 20th, we'll no longer be serving meals from Perkett at Sunnyside. We will also be continuing our delivery service on the Minot Air Force Base, and we will be doing a delivery service at Robbinsdale Trailer Park, Jefferson Trailer Park, Golden Nugget, Holiday Village, and the frontage road for Sunrise Colony and Holiday Park. All of the deliveries will take place each weekday between 11 and 1. And the meals on the Air Force Base will be delivered following the bus routes that were already scheduled out there, again, in the hours of 11 to 1 o'clock. We encourage people to take advantage of this option. This is available for children anywhere from 1 to 18, and also adults in the community with disabilities. So we will do what we can to continue those meals going. Any further decisions, if it goes past the 30th of June, will depend on federal regulations and recommendations that are coming to us. As a part of a community, we're here to serve, we're here to support, we're here to move this process along. We're pleased to offer these meal options for families. We're happy that CLC will be operating again, and that we can begin a summer school program for our kids. And if parents have questions, they can certainly reach out to their school office or to my office. We want to make sure that parents are comfortable with the process of bringing their kids back to school. We can help answer those questions and hopefully alleviate any stress that might be out there. The big question I get all the time is, what is the fall going to look like? And I have absolutely no idea. But we are planning our summer to make sure that we are addressing the issues of what school might look like. If we're in person, if we're distance learning, if we start in person and go to a distance learning model. The one thing we know is certain, we've been gathering a lot of data and input. We want to make sure that everyone that has a role in this has a voice to be heard. And I visited with a lot of parents through focus groups last week, and we're getting a lot of good feedback. We know what we did well, and we're learning what we can do better, and that's what our goal is. We believe that when we work together, we get better. For all the parents out there, I just want to say thank you for your diligence in making this work. We thrust you into a role of a teacher, and we know that wasn't all that easy. But we have a pretty special community, a community that survived a flood in 2011, a community that bands together. And I thank everyone for their role, our teachers, our parents, our kids, for making all of this work. So thank you all very much.
Thank you, Dr. Vollmer. Up next, we have Mayor Sitma with the City of Minot.
Thank you, Jen, and good afternoon. I've got three different areas that I'm going to talk about here briefly this afternoon. And of course, the first is the North Dakota Smart Restart, an update on where we're at locally with that. And it's been a little over 2 months since we began following the governor's orders right now. And by and large, we can't think of another reason or any other reason to shy away from the North Dakota Smart Restart program in progress. Of course, all of it was set out with one goal, and that was to flatten the curve. I think it's safe to say, after seeing a few spikes around the state, that right here in Ward County, we're still in the 20s with our positive cases. Our curve is flat. We expect, as the governor continues to roll out his Smart Restart, that we'll be right along the way with those guidelines as we have been from the beginning. What we are looking at for the city of Minot with our public facilities likely is an early June, a very early June opening date for most, if not all, of our facilities, including City Hall. We expect in the next 5 to 7 days to have the guidelines outlined on what that is going to look like. That does include our public meetings. We do have a few things that we do have to complete here at City Hall prior to that happening, but we expect, again, that to be in early June. So stay tuned for that. I've said it before, and I'll say it again, that I am exceptionally proud of the community across the region in all of the due diligence that most, if not the vast majority of people have undertaken to contain the virus, to limit its spread, community spread throughout the region. It has been outstanding when you compare that to other areas of the country and other areas around the world. I think that there is a lot to be said for North Dakota Smart and that resiliency that we took some initial action that has, I hope, is paying dividends right now in terms of the limited shutdown that we did experience. And not to say that we don't appreciate the sacrifice that many people did undertake during that limited shutdown, as we are very aware that it did have a significant impact for many people across the region. And we certainly want to, again, encourage folks as they do go out then, as we start to venture back out into the communities as reopening takes place, is to wear masks when possible. Keep that social distancing at all times wherever possible, and if not, the masks, again, are highly recommended in that case. We certainly don't want to see a setback or a hiccup with all the progress that we've made. I know the governor has outlined that many times. I know the medical professionals have outlined that, but I think it's critically important that we don't become complacent, because the fact that many communities across North Dakota have seen limited growth of the virus is saying a lot about North Dakota Smart. We've also talked about North Dakota Strong, but we're also North Dakota Minot Tough when it comes to getting through things. As Dr. Vollmer pointed out, the flood of 2011, we watched our community come together. We watched the region come together. We are seeing the same thing through COVID-19, and we fully expect to see this, that North Dakota Strong endure through the rest of whatever normal looks like moving forward. And as we go through, we certainly hope that perhaps maybe this is one of the last press briefings. Certainly, we're going to let the data and statistics outline of what happens there. Of course, with the due diligence from Ward County Emergency Management, First District Health Unit, the State Health Department, and the governor as we work forward. With that, I do want to also touch on our temporary emergency daycare operation. The response from the community was absolutely outstanding. Another great example has been the emergency daycare that stood up with the assistance for the healthcare workers and the emergency essential workers within our community. I can't say enough about the facility and staff, the meals provided by Minot Public School. Dr. Vollmer was on some of those first discussions that I think your exact words, Mark, were just, let's get this done. And to make it happen. So it has been an outstanding job that has been done by the CLC workers, by the Minot Public School staff that has been doing the cleaning, very due diligence within cleaning, and also managing that from the CLC. I also have to say a big thank you to the Learning Tree staff. They were critical to have essentially the components for the certifications for a daycare from the state guidelines perspective. So that has just been outstanding. We did have a capacity that was well more than 100. Thankfully, we never came close to reaching that capacity, and that, again, is through the due diligence of limiting the spread of COVID-19 within our community. But that is also saying a tremendous amount for our community to enable our healthcare workers and our emergency responders and essential and critical personnel within the city and county to have their assets, their most important assets within their family taken care of so that they can rest easy when they're at work on the front lines. Tomorrow is May 20th, and is also going to be the final day for our emergency daycare operations. And I certainly did not want that to go unnoticed, as I had a proclamation last night at Minot City Council proclaiming May 20th as a Daycare Appreciation Day within the city of Minot. And I would hope that a lot of folks reach out to their own daycare providers that stayed open through the months of March and April and into May to make sure that they let those folks know that they're greatly appreciated for their due diligence. So a big thank you once again, Minot Public School, 1st District Health Unit, Ward County, and Minot Police, Minot Fire, and the rest of the folks, Trinity Health, for helping get that up and rolling as fast as we did. It's typically not the easiest thing to do is stand up a daycare in 7 days, but it did happen. Lastly, I wanted to touch on Minot Air Force Base. I know that we talked a little bit about the flyover already for the appreciation that happened in Bismarck, Fargo, and Grand Forks and here in Minot yesterday afternoon. I want to say thank you to Colonel Bradley Cochran, the 5th Bomb Wing Commander, and also Colonel Glenn Harris, the 91st Missile Wing Commander, for the outstanding job that they have done as partners at Minot Air Force Base to the community of Minot. They have done an outstanding job with all of their different guidelines that they set forth immediately to show just how, I think, exemplary their work has been done. This past Friday, General David Goldfein, the Chief of Staff of the United States Air Force, was at Minot Air Force Base and invited myself and Alderman Mark Janser, he's the head of Task Force 21, up to Minot Air Force Base for a social distancing meeting. And that essentially was to find out exactly what Minot Air Force Base did, as they had a single infectious case that was identified at Minot Air Force Base and no other infection spread. And then also the colonel was interested in how the community reacted in collaboration with Minot Air Force Base, as well more than 50% of the airmen and women stationed at Minot Air Force Base, including their families, live downtown, live right here in Minot. So what we did directly impacted their operations as well. So we had a great half-hour, 45-minute conversation as he had many questions and was very happy to see just at how much success the folks at the Air Force Base as well as our community had in dealing with this. It was taking that back to the Pentagon to share throughout their different resources. So an outstanding job, again, by both wing commanders at Minot Air Force Base, the personnel, the military families, and the entire community of Minot, because all of it is so intermingled with all of the different important roles that we all play within our community, and I absolutely cannot let that go unnoticed. So I'll stand for questions here after all of the presenters have had a chance to speak, and I wanted to say thank you once again to the media for coming for a press briefing. Thank you.
Thank you, Mayor Sitma. Up last is me, Jennifer Witchman, on behalf of Ward County as well as our Joint Information Center. My first announcement is primarily to use you watching as well as the media. This will be our second to last press briefing, so this is our notice for that. We've noticed a decline in a need to have a full press briefing, so this is our notice for that. With that, I have announcements on behalf of Ward County. Ward County will be opening their administration building next week on Tuesday, May 26th, for business as usual as it is now prescribed. We have put measures in place based off of recommendations by the CDC, OSHA, and the North Dakota Department of Health and the Governor's North Dakota Smart Restart program. But we continue to promote alternative forms of communication when possible. So whether that be by phone, email, website, traditional mail, or Dropbox. Now we do have a Dropbox in front of the county. It is located on the west side of the building. And a note for that, that is where ballot drop-off is for Ward County and the Ward County Library Dropbox. The City of Minot Public Library Dropbox is not for ballots, just as a public service announcement. Any ballots that have been dropped off there have been delivered safely to Ward County, so don't worry if you dropped it off there, your vote is still being counted. But just as a note, that is the Ward County Public Library to drop those off at. With that, we have a few departments that are operating differently despite our reopening. The Veteran Service Office will continue to be by appointment only. Our library will have different operating procedures as well as hours. They will be open Monday through Friday from 8 to 4:30. They have no evening or weekend hours as of yet. They will be releasing further guidance on how their operating procedures will be changing via our website as well as through their Facebook page later today. And the big one is Ward County Human Services. Their lobbies on the 3rd and 4th floor will still be accessible to clients with the reopening. However, face-to-face visits with staff will continue to be done by appointment only. So this is in order to minimize the spread of COVID, and they encourage interested parties to do as much as possible by utilizing the website, phone, email, and regular mail as well. Those interested in applying for assistance such as SNAP, medical assistance, child care assistance, and TANF are strongly encouraged to apply online at www.nd.gov/DHS/eligibility. As of May 26th, with our reopening, paper applications can be picked up in the first floor atrium of the admin building rather than the courthouse, so as to minimize traffic to the other floors and unnecessary crowding of people in the elevators. Completed applications and any verifications needed to determine eligibility should be put into an envelope and placed into the drop box. This is emptied twice daily. Interviews required for economic assistance purposes will continue to be conducted by phone until further notice. Lastly, face-to-face visitations between foster children and their parents will resume in the coming weeks as scheduled by case managers. So protocols will be in place to minimize the risk to children, parents, and workers as much as possible. So on behalf of Ward County, we are looking to follow this North Dakota Smart Restart guidelines. And with that, if you are coming to our building, please, if you have a cough or fever, do not enter the facilities. Practice social distancing with that 6-foot gap in between people. Practice good hygiene and limit any unnecessary contact. On to happier news. We want to, on behalf of Ward County, congratulate 2020 grads. All of you seniors had to improvise, adapt, and overcome these challenging times, and despite that, you still continue to graduate, so congratulations to you all. And with that, somebody that kind of helped adopt these seniors is our hometown hero for the week, Natasha Marker. She set up a local Facebook group for Minot so people could adopt a grad and contribute to their special memories that they didn't get to have because of this pandemic. So congratulations, Natasha, and we appreciate all the work that you did. With that, if you would like to nominate any hometown heroes that you have that you see doing good things in the community, particularly that are doing things because of the pandemic, please feel free to reach out to Visit Minot or the Minot Chamber of Commerce and nominate people. And with that, we will stand for questioning. Yes. Question for Dr. Vollmer.
Graduation ceremony is a very happy time. People usually hug each other, they give high fives, they take a bunch of group photos, things like that. So just within the grandstand ceremony atmosphere, how do you kind of still maintain that distance when obviously a lot of people are going to
One of the things I think was very helpful is that Renee and her crew at the State Fairgrounds gave us a full map of the grandstand. So students that are graduating have a seat that they will be going to, and they will also, their parents as well. So, we have seats blocked off and specific seat assignments. At the end of the day, we can't control what everyone does. What we can remind people is that we have gotten from the beginning to now with just a handful over 20 COVID-19 cases in our county, and we need to keep that smart. I think a lot of people get that and they understand that, and we just need to continually do that as a reminder. So we're planning some different things with how the graduates come in, focusing that social distance. We'll have extra workers there to remind people to follow the social distancing. There will be ample sanitization stations there for hand sanitizer and people cleaning the bathrooms throughout the course of the graduation. Please understand our graduations at Minot High, and I'm proud to say this is my 18th now, they're about an hour and 15 minutes for about 450 graduates. So we move people in and out, and everybody gets their moment to be honored. But at the end of the day, we just want to remind everybody, follow those social distancing guidelines. We've come this far, and we've been smart about what we do. So just a reminder to everybody, please keep everyone safe. Yeah.
You had a couple less locations you're going to be having. Are the field numbers still going to be around that 6,400, or is it going to be less field? How do you kind of define that scale back?
The scale back will primarily be to maximize kitchen space and to maximize employment. At the end of the day, we do have to watch our bottom line financially, so it won't be any less meals. It will be operating at 2 less spots. For those 6 schools or those 4 schools that I mentioned in town, those are going to be anytime during that 11 to 1 time. People can have curbside service. They can pull up. They'll be given meals, no questions asked. And then we will still continue the same delivery. So it will be more of a focus on more production and fewer sites than it will be than the anticipation that we'll have less meals. And we'll adjust that accordingly. If we have more need for meals, we'll increase the amount of meals that are being done every day. So it'll be solely based again on what the need is in the community. So I see another question back here. I have not had an opportunity to check with the principals yet. We had a lot of students that were very concerned about, whether or not it would be a distance learning platform or not. My understanding was many of the students were hoping it would not be a distance learning platform. Kids learn differently, right? And some kids excelled in the distance learning model we had, and other kids, they need to have a teacher in front of us. We've been doing this, German model of education in our country since 1850, and it still having a teacher in front of kids, we believe a caring, nurturing adult is the best thing that we can do. So we had mixed feelings on it, but with this blended model, we believe it keeps us socially distanced. It keeps people as safe as we can be. We'll have the provisions in place. And if the data is showing us otherwise, then we'll look at a distance learning model across the board for the remainder of the summer. But this is an opportunity for us to follow the guidelines that are set forth and see what we can do to keep people safe and get back on track a little bit.
Question for any health official could answer this. Apparently we got word there's been by appointment COVID testing going on near Valley Sport Marine the last couple of weeks. So who's been running it? Open to the public at all? And so what do people need to bring to that?
Sure. The question was around the drive-through testing that may be being conducted on Elk Drive up by, on the southwest side by Valley Truck and Marine, I think is what you asked. So Trinity Health has been conducting a drive-in testing since the beginning of this pandemic, since testing became available to those in our community that have symptoms. And we've talked week after week about how those symptoms and the criteria may have changed from week to week, but our presence and our effort in testing has not wavered. So that testing site that you mentioned is a Trinity Health drive-in testing facility. That is where we conduct all of our drive-in testing today. And I've reported week after week about numbers. We started out in the 50 to 60 per day and have gone down to 20 to 30 per day. And those are the number of people who call in with any symptom of COVID-19 and want to be tested. We are still doing that today, and we'll be doing that until it's no longer necessary.
So Minot's around like the 20s for cases seems unusually low. I mean, what do you really attribute that most to?
Yeah, I think it would just be subjective, what we attest to. I'm not a clinician. Maybe Dr. Sather has insight on why we are exceptionally low in Minot for our population when you look at the rest of the state. I think part of the credit is what Mayor Sitma talked about, and that our community, and I think we've all talked about it one time or another, how well we are doing with the guidelines that came down from CDC and Department of Health since the beginning, on distancing, on wearing masks, on our discipline around that. And so how early we recognize that, we set up drive-in testing immediately. The schools went to a distance learning platform in less than a week, I believe Dr. Vollmer reported. We have been masking and distancing and across healthcare in this community since day one, practically. So I think, and how well we restart and how well we follow the guidelines that have come from Department of Health, I think have a big role to play in where we're at today.
Randy, just to clarify, so you just moved your testing from
Yes.
medical arts up to?
Right, so we did have our initial drive-in testing was conducted at Medical Arts Facility. And a few weeks ago, I reported how we were moving that facility back to as normal as possible. First Care became very active in COVID testing for a period of weeks. And that facility suited our needs perfectly at the time. So First Care walk-in clinic has now reverted back to a First Care Call First clinic. But same-day appointments for all types of health care. If you are COVID symptomatic, we have set up a separate clinic altogether, respiratory care clinic, to serve those patients. And we moved our drive-in testing, because it's by appointment only. Our staff still do the screening on the 857-7817, I believe, phone number. They'll still do the screening and arrange for those drive-in appointments at that new site. And so they'll guide you to where to go. So you'll see some signage on site, but it's not big and dramatic because we are giving you turn-by-turn directions on how to access that after you're eligible to go. Thank you. I think we made that change a couple weeks ago from Health Center Medical Arts to that Southwest site. Pardon me? Oh, and Lisa wants to add on to that question. Thank you.
Thank you. Randy is exactly right. We don't have good data. It will be hard to get data that says this is why our numbers are like they are. However, we can speculate on a few things. First of all, we had the first case, and we were about a week earlier than everybody else, and this community ramped it up quick. They were concerned when they heard of that first case, and I think that this community took it very serious very soon because of that first case exposure. The other thing, too, is that we have been very, very aggressive with contact tracing. So when we have identified these cases, we have responded quickly within that day, contacting people and saying you have had a contact with a positive case, and have asked them to isolate, call in temperatures, and so forth. And by and large, the community has been outstanding in their cooperation with that. Getting to those positive cases quickly and identifying those contacts have been, I think, key in holding these numbers down. So I too want to congratulate the community, but I also want to warn that this is not done. Just because things are opening up and so forth, it is at any point we can get a hot zone, and I'm not trying to be fearful. I just want everybody to be aware that this is still in the community. People can be transmitting that are not symptomatic, and so we need to be vigilant. So please, please continue what you have been doing. We hope you enjoy some shopping and some restaurants and so forth, but do it cautiously and continue to be vigilant and hold those numbers down. So I too, as the executive officer of the public health district, I want to congratulate the community. There is no one entity that can do something like this, and it really boils down to the people taking the precautions they need to protect their health. So congratulations.
Lisa, there's been a little frustration that I'm sure you've shared over Ward County not being able to have sentinel testing for the general public. Sort of got pushed by the wayside a little bit because of some broken equipment. And the state changed its focus to more targeted groups. Can you talk a little bit on that and explain why Minot was really the only community, large community in the state that did not have sentinel testing for the general public, and how the state is deciding who gets tested in these mass events? And do they communicate with you and ask you who you think you should be tested, or is it dictated?
It is, right now, the process to get tested is a request that goes from us up to the state. There are various, and so we have sent in, like I said, the tests for this community on healthcare workers, emergency responders. Right now, there are not the number of tests available just to do sentinel testing. And at the time when there were a few sentinel testings, and there weren't a lot, but they did a sample down in Southwest. That was kind of their pilot. That was their pilot project, and to see how it went. They chose a community that was a low population, did not have exposures, just to give this drive-through a test out. Then they have done it where cases have warranted, or there have been concerns within the communities where they have done more broad-based testing. At this point, we continue to look at those high priority areas, and at First District, we are prioritizing healthcare workers, emergency responders right now. Until we get those areas done, and as always, long-term care providers. So we have a lot of healthcare workers. We have a lot of long-term cares in the district. We have a lot of emergency personnel. And so once we have kind of checked that off the list, but for the most part, that's what's going on around the state, unless you are in a Fargo that has they're conducting 1,000 tests per day.
So you do get the opportunity for input. You get to decide who gets tested then?
No. I get to put in the request. Then there is a state testing group that determines who will actually get the tests.
So if we were concerned about grocery store workers and other workers at essential businesses that provide essential, the larger stores, is that a request you could put in to have those workers tested?
Yes, we can put that in. I wouldn't anticipate that we would put that in until we've dealt with the healthcare workers and so forth. But I certainly would view that as probably the next level of testing. Yes.
The number of tests that you would do the sentinel testing for the general public. Did you make that request, or does the state give you that?
The state likely gives us the number of tests available. we give them the number and then the, an estimate that we think that we could do. And then typically that number is assigned, and then it's all based on lab capacity, and how the test kits are coming in. So there is a limited amount of tests that the state lab can run, and they divvy out those tests every day. And so that's why you don't get confirmation until about 2 days prior to the event, whether or not this will happen. Because if a hotspot is identified and those tests and lab capacities need to go elsewhere, that's where they go. The other thing I did want to say too is another area of priority will be contacts of positive COVID patients. So I would see those as a high priority for us to get to also. Thank you.
Question for Dr. South.
All right, and this is our 5-minute warning as we are up against the governor once again. But for Dr. Sather?
Hello.
Dr. Souther, we've all probably, most of us have heard about the children on the East Coast who are turning up with a Kawasaki disease type COVID-related syndrome. Have we seen anything like that in Minot?
We have not seen any Kawasaki-like illness. The question is around Kawasaki-type illness in COVID-positive children, and we have not seen that in the community here. We have not seen a lot of sick kids. I can't speak statewide. I do know the vast majority of our positives that have been sick and hospitalized have been elderly. So I'm not aware of any cases like that.
Just with the press briefings being done after next week, I just wondered maybe any way from city, county, or health organizations, what's the best way, or the next way you guys would be continuing to give out public information, or just a way to give feedback and questions throughout the public?
So the question was, what's the best way once these press briefings end, how we will continue to get all of our information out? And one of the quickest and easiest way is going to be through social media. That's where we still continue to push all of our information. Our Joint Information Center is still up and running to make sure we try to coordinate our messages. But that'll...
Sorry, social media is not a news source. We need to know who we can contact to get official word from that we can quote.
If I could finish, I was getting there. Yes. We'll have more official ways next week, but if it is department specific, you're always welcome to reach out to a department head or to the mayor if it's relevant to the city of Minot or places like that. More specific information can be put out next week. Social media, as I said, is the quickest way. If it's something relevant and large, we will still put out press releases for things. And should the need arise, we would still stand up this press conference if it was needed. Let's say if we have a spike in cases or something like that, we can absolutely stand this back up, have it in its original time slot, and have that ready to go. But through the official avenues that we had before this press conference existed, that's how we'll be sending the message out. Does that answer your question?
Yep.
All right, this is our 2-minute warning. Do I have any further questions? All right, hearing none, thank you for coming.